Okay.
Well, UAMS-South actually started as the AHEC in El Dorado in 1973, and its primary purpose, and originally being developed, was to provide professional education to physicians and to other healthcare providers in the community and in the regional area. And I think about I want to say 1980, 1979, I don't know the date exactly, the residency program was added. So over the years, our role has changed into primarily two paths or two tracks, if you want. One, we take physicians who have graduated from programs from all over the world, who have gone through all of the standard hoops to get into a residency program. And these guys here are specializing in family medicine. Um, Most people don't think of it as a specialty, but you know, if you walk in and you've got a toe ache, or you walk in and your arm hurts, they've got to be able to treat the whole person. And they are becoming more and more important in the new healthcare movement that is rolling out. So we have 9 residents that we're training. We have them in what we refer to as classes. We have what's called PGY 1s, 2s, and 3s. The ones are our brand new residents that are coming in. And the thing that I would like to emphasize about this, because a lot of times people think of these guys as students, these are physicians who have passed all their boards, done everything. They're bona fide physicians. And many of them have practiced in their countries of origins for several years before they come to the States. So these are, these are not trainees. These are actual physicians. And then I have 3 faculty that provide the teaching and the attending. We offer an outpatient clinic and we do hospital work at the local hospital. Um, so that's one of the primary things that we do. The other thing that we do is what I would refer to as outreach. We have one gentleman on staff, Dennis Cooper, whose sole job is what we refer to as pre-health recruiting. From the time, let me just say, a high school student decides that he wants to become a physician, you're looking at nearly 14 years worth of training or more. And so we're trying to introduce students to the healthcare careers, what's available to you. So Dennis goes out and, much like when I was a kid growing up and President Kennedy said we were going to the moon, all the high school teachers push math and science. Well, we're actually encouraging healthcare. Dennis also runs what we call a MASH camp. And we've done this for several years. This is a 2-week camp in the summer where counselors in various high schools recommend students, and we take them and then we expose them to a 2-week camp designed around healthcare issues. Then I have a young lady named Rebecca Wendling. It's Wendling. Rebecca's job is really what I would refer to as community outreach. Rebecca runs what we call baby safety showers. It's a concept that started out of children's, teaching young mothers safety issues. For example, car seats. How do you install a car seat safely? Or playpens or whatever. And Rebecca's been very fortunate. She's gotten a couple of grants from Blue and U to do that. She also is involved in the local school in Magnolia and in Camden and other places, and goes in and teaches, I think it's between 20 and 30-minute intervals in various classrooms talking about nutrition. And she teaches a little program called Catch. And I apologize, I do not remember the acronym and the name. But essentially, she's very pleased when she sees one of her students in the grocery store picking up a can and looking at the label and saying, "Mom, you can't do this, it's got this," that kind of thing. We try to do health fairs when we are invited to do so. And so if you can think of what we're doing, we're trying to train physicians, provide a clinic in the community, and then at the same time we want to outreach into the community through encouraging kids to get into health careers, and then to do the kind of outreach. We have another lady named Susan Rump. Now Susan is an employee of ours, but Susan is under a state grant, and her grant deals with substance abuse. So she has a couple of people that work with her, and her territory is about 11 counties. And primarily what they do is train the trainers. They go out and she has a warehouse of substance abuse literature that anybody is welcome to have. And they go out into counties and communities and work with the established coalitions in that area, trying to get the message out about drugs. And Susan's been doing this for 18 years, and they do a wonderful program. That essentially is functionally what we do. We're part of UAMS, the only medical school in Arkansas.
Talk to me a little bit about the relationship you expect UAMS-South will have with Magnolia Regional Medical Center and Southern Arkansas University.
We're hoping, well, first of all, we wouldn't be here if the hospital hadn't invited us. Residency programs, and this is just kind of a technical part, the residency programs are funded by the government, CMS, by funding through a hospital, and the hospital then passes that money on to a residency program. That's just the general way. So if you don't have a teaching facility, a hospital, you can't have a program. So when Margaret West approached us and says, gee, would you consider this coming to Magnolia? We looked at it, we modified our program, and when I say modified our program, at one time we had 6 residents in each class, and we were going to begin. The size of your class actually depends, on the census of the hospital, and this hospital is smaller than the one that was in El Dorado, so we adjusted our class size in order to fit that. So we have I think, a good partnership relationship with a local hospital. At least that's our intent, and I think that's Margaret West's intent, that we work closely together, because she allows us to do training and be involved. As far as SAU is concerned, I think we're building that relationship. I don't know whether you're aware or not, but our residents now are working with the athletic department. So like with football games and stuff like that, we have our residents there. I think when football's over and basketball season starts, we will do that. We're hoping to establish a real close relationship with the nursing department, so that their nurses who are in training can use us for precepting. Now, I don't know how many we can take at a time, but I hope to see us develop a really good relationship with Dr. Rankin and his group.
What do people in Magnolia and Columbia County absolutely need to know about UAMS-South as to what it has available to, what it has to offer to them?
Interesting question. When I say interesting question, I guess, the primary thing that I think, outside of the educational things that we talked about earlier, is the fact that we run a full service clinic here. And, we're not in competition with the other physicians in town, because many of the other physicians are teachers. They teach our residents. So obviously we're not trying to go out and raid anybody's practice or anything like that. But our doors are open to anyone that would care to use our clinic. That's what I think they need to know. I think we're bringing, the other thing I think we're doing is my assistant, Cindy Salisbury. I don't know if you know Cindy or not. She made a comment the other day. She said, well, Dr. Fitz, she says, how many places do you know that you suddenly and overnight bring in 15 physicians? And I thought about that, and I said, not many, but what our hope is that by training people in rural areas, and you know it's difficult to keep docs in small communities nowadays. Urban areas seem to draw them. And that's just nationwide, that's not just Arkansas. Our hope is that by training physicians here who have a love of rural medicine and will grow to love this community and want to stay, or stay in this region. And then they will establish their own practices. That's our hope.